The Department of Health has reported that our latest number of confirmed cases of COVID-19 as of March 11, 2020 is 33. Hence, in light of the first local transmission reported last March 7, 2020, and the sudden upsurge of confirmed cases, President Rodrigo Duterte has declared a state of public health emergency throughout the entire Philippines by issuing Proclamation Number 922 in order to mobilize governmental and non-governmental agencies to respond to the threats brought about by COVID-19 infections. Last March 9, 2020, I had the opportunity to attend the 10th Interagency Task Force on Emerging Infectious Disease meeting where the DOH briefed the President and concerned agencies about the current status of COVID-19 in the country. Yesterday, the Committee on Appropriations has approved 1.6 billion which the Bureau of Treasury certified as available. But in the meantime, the supplemental budget is not yet approved. The DOH has a total of 3.1 billion available funds consisting of 2 billion from PAGCOR and 4.50 million or 450 million from PCSO, 180 million from QRF or Quick Response Fund of DOH, and 539 million possible savings from DOH from last year's budget. So rest assured that we have available funds to combat COVID-19. This morning, the Committee on Health conducted a briefing in order to give Department of Health an interagency task force as well as other concerned agencies of the government an opportunity to inform members of the legislature regarding the latest development of COVID-19. Given these recent developments, I have decided to file 2 bills to address the gaps that we have experienced under our current situation. First, I filed last March 5, 2020, House Bill 6493 entitled An Act Providing for a National Health Security or an Act Providing for a National Health Security and Appropriating Funds therefore, or otherwise known as the Philippine Health Security Act. This bill proposes to establish the Philippine National Health Security Council that will craft a health security national action plan, a country-owned, multi-year planning process that can accelerate the implementation of the World Health Organization's international health regulation core capacities. It captures the national priorities or health security, brings sectors together, identifies partners, and allocates resources for health security capacity development. It also serves as an overarching process to capture all ongoing preparedness initiatives in the country, along with the country's governance mechanism for emergency and disaster risk management. It also seeks to provide and strengthen the mechanism for the health security interface, optimize health security based on the country's unique risks, challenges, and resources, and develop an effective risk communication, among others. The second one, which I filed March 9, 2020, is House Bill 6514, entitled An Act Providing for the Establishment and Operation of Additional Quarantine Stations, Grounds, and Anchorage in all strategic areas throughout the country and appropriating funds therefore, and seeks to preempt the spread of communicable diseases and to prepare for the spread of infectious diseases that may occur in the future by establishing additional quarantine facilities in order to accommodate and contain diseases that may occur in the future by establishing additional quarantine facilities in order to that may pose a significant threat to public health. I am also planning to file in the coming days another bill seeking to establish centers for disease and prevention, which seeks to strengthen the bureaucracy that is mandated to address communicable diseases in the country through the organizational and institutional reforms. As the country continues to face threats from disease outbreaks and other public health emergencies, we need to proactively establish the systems and engagement needed to detect and control potential disease outbreaks. As of 18th Congress Accomplishment Report of the Committee on Health, on our end, in the House Committee on Health, and in light of the recent global health threats and issues, we strive to be even more proactive in performing our mandate to provide quality, effective, and affordable healthcare to all Filipinos through meaningful and landmark legislation. In the first regular session of 18th Congress, the Committee on Health has a total registered bills around 561 primary referrals of House bills, both of national and local significance, and 43 House resolutions were primarily referred. Of these, 182 measures were acted upon by the Committee on Health as today. Of the total measures referred to the committee, one measure, which is the Malasakit Center Act, was signed into law last December 2019, and its implementing rules and regulations signed last February 24, 2020. We have also acted on the following priority measures: the Comprehensive Renal Replacement Therapy Bill, the amendment of the National Program for the Elimination of Tuberculosis, the Mandatory Immunization Program, the e-health system, the indication of blood types in all IDs or certificates and licenses, and lastly, the oral health program. So we are hoping that these bills will also be acted upon by the Senate upon the resumption of session in May. That's all. Thank you so much. Do you have any question?
Just one question na. Marami po mga mungkahi na narinig natin kanina sa inyo. Sorry sir, sa inyong pagdinig kanina. Ano sa palagay niyo yung mga suggestions ng ating mga magkabatas po kay, lalo na kay Secretary Duque, na talagang una nanggaling po sa inyo, sa iba pa yung mga
Okay. Thank you so much. I think number one is to make the communication, especially the information dissemination, efficient and effective. Dahil nakita natin na currently kung ano-anong impormasyon ang nakikita natin sa iba-ibang platforms, no, social media, ay mukhang may problema doon sa messaging ng Department of Health. Yon, una siguro kailangang strengthen nila. Number two is yung currently yung capability natin on testing. As of now, as of today, I think hanggang ngayon RITM pa rin ang meron tayo. Although ang RITM, nagkaroon sila ng assessment to 5 subnational level centers, pero hindi pa rin siya strategically located. Like for example, meron lang tayo sa kung sakali, no, talaga na magamit yung Vicente Soto, I think Southern Philippine Medical Center in Davao. We also have Lung Center here, UPNIH, the Baguio General Hospital, and I think San Lazaro. But according to Secretary Duque, still they're looking into yung UPNIH in the coming weeks, as discussed in the interagency meeting last Monday. In the next week, he promised na mag-start na ng testing ang UPNIH. Pangatlo, yung the guidelines, no, from the interagency task force on COVID-19, nakita natin kanina that there were some miscommunications on sino ba ang unang magbababa. Like the issue on social distancing, yan yung recommendation as of now based on the code alert system, no? Pero when I asked Secretary kung meron na bang naibabang guidelines, operational guidelines, wala pa. I was able to get a draft, so hindi ko siya ma-share, no, kasi subject to review. But the ILG issued on a memorandum for the upcoming barangay assemblies that binibigyan nila ng discretion the barangay captains or the local chief executives to decide on that if they can postpone or cancel those meetings. Next is on the decisions of I think yung the secretary having that power in times of public health emergency na hindi na ma-maximize to exercise, like what Congressman Biazon raised, based on local government code section 105, na nung una pa dapat nagamit na ni secretary. So yun I think at this time ang mga importanteng rekomendasyon na dapat ay tugunan ng ating Department of Health. Thank you so much. Yeah. I would like to thank the speaker for expressing his support on that, no? Kasi as I mentioned kanina, I was able to attend the interagency task force meeting in Malacanang last Monday. And isa ito sa ni-raise doon na usapin kung possible ba na i-certify urgent yung pending bills namin dito. Unfortunately, the Department of Budget and Management during that time, sinabi niya and inassure niya na may available funds at the moment na pwedeng gagamitin, and he said na kung kinakailangan ay hindi ngayon, but maybe baka on May or i-reassess nila. But syempre ako, kung ako ang tatanungin mo, we still need additional fund para magamit ng Department of Health. Katulad ng yung projection nila na 3.1 billion, no, currently based on their presentation. Isa sa ni-raise kanina yung medical management of cases, which I think is not clear doon, no, kasi may 450 million pesos galing sa PCSO, and ito ay gagamitin ng PhilHealth. So yung mga nagkakaroon ng sakit related sa COVID, doon siya ikakarga. But may limitations pa rin siya. Kulang pa din siya kasi as we all know, may mga cases tayo na may mga pre-existing conditions. So mas malawak yung kailangan nila. Thank you. Based on the answer ni Secretary Duque kanina, sinabi niya mid of this year, no? But kung titingnan po natin, pag-aralan natin ang kaso ng China, no, sa Wuhan. They started December, and ngayon nagsimula na pong mag-subside. So more or less mga 3 to 4 months we're expecting, no, na bababa dapat siya, no. Kung ibabase din po natin doon sa nangyari sa SARS at saka sa MERS-CoV, no. But of course, tayo, we're praying na sana the soonest the possible bumaba na siya or mag-subside or totally mawala siya, no. Globally, not only in our country, hindi pwedeng sa bansa lang natin, but all over the world, no. I can't answer on the specific numbers, no, nung basehan nila kung ilan talaga yung masasabi mo na peak, but ang narinig ko din sa kanya kanina or in previous interviews, it has to be thousands, no. How many thousands, I can't give you the exact number. Yeah. Yes. So isa yan sa issue, no, na talagang tinitingnan natin. Yung WHO, they said, when I talked to them, they gave the list of suppliers of the reagents or testing materials to the Department of Health. But, considering nga na global demand, very challenging talaga yon. That's why as of the moment, siguro, kaya tiningnan nila yung test kits developed by the local doctor ay tinitingnan nila na isang possibility na magamit as a form of screening, no? May problema doon sa supply talaga, no? And hindi lang naman sa bansa natin, but globally it's a problem. Yeah, it's free actually given by WHO. But yun nga, problema din ng WHO eh. Yung pagkuha ng supply na ibibigay sa member countries eh. Kung papaano nila ipa-prioritize and i-distribute siya. So it's a global problem actually. Yeah, kanina nagkaroon ng motion on that, no, at our Vice Chair Defensor, na kasi currently ang tinitingnan, meron kasi tayong isolation package, no, so case rate siya, so fix yung amount na binabayadan ng PhilHealth. And na-manifest ko ang aking suporta na dapat isuspend yung case rate nila on the isolation basta related siya sa COVID. So kung magkano yung expenses ng isang positive patient ay kailangan i-cover ng pamahalaan. So wala siyang out of pocket.
Ano po yung commitment recently sa IRR ng 11? Tsaka why is it important po?
Yeah, kasi yung Republic Act 11332 is a mandatory notifiable diseases, no? Supposed to be nagamit niya na reference yun in the implementation kasi isa na tinatask sila doon magkaroon ng emergency response system. I hope, no, na within the week until Friday makapaglabas sila ng IRR kasi napaka-importante yon. Siya yung magiging guide ng Department of Health sa pag-respond nila, especially in this time na COVID-19. So nag-promise naman siya. Siguro ako tutukan ko na mailabas yung IRR ng RA 11332. Nagulat nga ako kasi na-raise ko na yan even before sa kanila. So I was surprised na until today, maybe overwhelmed sila with all the problems right now. Yeah. Yun po yung ni-raise natin, no? Kasi currently, yung rates, kasi naka-case rates po tayo. Kung sakit mo, pneumonia, how much lang ang rate. So, over and above, babayadan po ninyo. Kaya nagkaroon ng motion kanina, isuspend yun at i-cover. Pwede naman po yun, ginagawa natin yun. And we have fund, I think, in PhilHealth on the point of service. Na yung ating mga COVID cases, kung magkano talaga na-incur nila na expenses on hospitalization, bayadan lahat. Which I think naman naintindihan ng PhilHealth representative and Secretary Duque is the chair of the board po ng PhilHealth. So, he can raise that. But I'll be in PhilHealth on Friday. We'll be attending their EXICOM meeting so I can raise that issue. Most likely they have mga reports, but we'll ask DOH. Okay? Thank you so much. Maraming salamat po.